Good morning. Today is Sunday, November 1st, 2020, and I'm Margaret Drugovich, the president of Hartwick College. Well, it's not going to be the sunniest day in Oneonta, but it's going to be a great day, nevertheless. Before I begin my update on COVID-19, I'm pleased that we were able to announce earlier this week that the Hartwick College commencement ceremonies for the classes of 2020 and 2021 will be held on Saturday, May 29th, 2021. The format of the ceremonies, of course, will depend on COVID-related restrictions and guidance on gatherings. We do not know, actually, at this time, if any form of in-person gathering will be possible, but we will make that determination as soon as we're able. I'm glad that we have set the date, and I look forward to the celebration of our students' success and what we have learned together. In whatever form it takes, as it is every year, it will be a wonderful celebration. With that, on to COVID. Well, after several weeks with very few new active infections, we saw another rise in new cases over this last week. As of this morning, we have 30 total active cases. That includes 3 new cases that were identified yesterday. Though contact tracing has not been completed on every case, we now know that at least 2/3 of our recently diagnosed cases are linked to activity in a specific bar in Oneonta. These cases appear to be the result of visits to that bar or contact with people who have worked in or have visited that bar. Other cases on campus appear to be linked to socializing in other settings while not wearing masks. A number of our cases are students who were infected but were asymptomatic. Fortunately, they were diagnosed through our on-campus testing program, which is exactly why we will continue with that on-campus testing program. While we do not have complete contact information for every case, we can see the clear connection between being in a crowded space and contracting the infection. This should not be a surprise to anyone. We have learned over the last 8 months that COVID-19 is spread most efficiently through respiratory droplets passed between people. Adhering to the simple rules of wearing a face covering and keeping a safe 6-foot distance continues to be the golden rule when it comes to COVID. In light of these newly diagnosed cases, the college is taking additional steps to protect our community. Last week, I asked students to remain on campus because of the spread of COVID throughout New York State and the region. I'm asking you again to do this. Students who do choose to travel do need to complete a travel declaration form prior to leaving. And if you leave the area and travel to a red or orange cluster zone, you will not be allowed to return to campus this fall. In addition, given the increase in infections and to protect every member of our campus community, we have taken the following actions. This past week, we suspended all nursing clinical placements and internships. The initial period of this suspension is 2 weeks. A decision to extend this suspension will be made based upon what we learn about further infections. Also, on Thursday, we announced that until further notice, all campus dining will be takeout only, and the use of the fitness centers and the indoor athletic facilities is suspended. And finally, on Saturday, Vice President McGrath announced that effective immediately, any violation of our social compact or visitation policies will result in students being required to leave residence halls for the remainder of the semester. If there's a violation, you'll need to study remotely and you will not be allowed to return until J-term. There will be no additional warnings. Commuters and authorized off-campus students who break the social compact rules will also be required to study remotely and will no longer have access to campus. At this time, we have no evidence of classroom transmission. So, in-person instruction will continue. I remind faculty and staff, you are to maintain at least a 6-foot distance from students and other employees while in classrooms, labs, and studios, and that face masks for all, are required at all times. And please be sure to adhere to your campus-based testing schedule. We're going to continue to evaluate the circumstances as they evolve and take actions that are required to protect all members of our community. I like hearing from our parents. A parent asked me this week whether we would follow the state mandate to revert to remote-only instruction when we reach the state-defined threshold limit. The answer is yes. If we get to 61 active cases, which would be 5% of students and employees currently coming to campus every day, we would automatically revert to remote-only instruction. However, I want to note we could also make that decision earlier if we believed that such a decision was necessary. I know that these actions are probably frustrating to the many students who are trying very hard to complete the fall period of on-campus study, just 21 more days. What I would say to all students and employees who are following our COVID rules on distance, masking, testing, and hand washing, your reward will be that you are continuing to protect yourself by following these rules, and that is the most important thing. I sincerely thank you for doing your best. I very much appreciate your willingness to forego some of the things that you would like to do in favor of protecting yourself and others. We are learning many important lessons about what being in community really means. They are lessons that will shape and strengthen our understanding of what it means to care for others. They are lessons we will not forget. Over the past week, more than 500,000 new COVID cases were diagnosed in the U.S. On Friday, over 90,000 new cases were recorded in the U.S., a record one-day high for the number of new cases. The U.S. now has more cases and more deaths than any country in the world. Because of the continued spread of cases throughout the U.S., I would ask our students and employees to please take note. We will be changing our strategy for testing students starting the week of November 9th. The goal of this change is to ensure that every student has a negative COVID test within 10 days of their anticipated November 21st departure from campus. We have not been required to make this change. We are making this change because we believe it is in the best interest of our students and their families. Now, this change will also impact our employee testing schedule for the week of November 9th. And so students and employees, please watch for an important announcement about these scheduled testing changes. Also, students, please be sure to check the travel requirements that might be in place for your destination state. As a reminder, all students who are not in campus-based quarantine or isolation at the time will be required to leave campus by noon on November 21st. One related update that I want to give you this morning. You know, for months, New York State has had travel policies related to COVID-19. Now, on Saturday, Governor Cuomo announced a significant change to the state's travel policy. Effective this coming Wednesday, on November 4th, travelers to New York will have an option to the mandatory 14-day quarantine. So, travelers to New York State will be able to quarantine for 14 days, or they can take these alternative 3 steps. The first step is that travelers from every state should produce proof of a negative COVID-19 test taken no more than 3 days before their arrival in New York. Upon arrival, then the traveler would then have to quarantine for 3 days, and on the 4th day of quarantine, the traveler could get another test. If that test is negative, their quarantine can end. However, if the test is positive, the traveler must remain in quarantine. Travelers who choose to forego testing, of course, would remain in quarantine for 14 days. Now, importantly, this new policy applies to travelers from all states except those that touch on the borders of New York. In another change, the governor announced that travelers who were in another state for less than 24 hours do not need to quarantine, but must get a diagnostic test on day 4 of their arrival back in New York. I note these changes now because they will impact our controlled move-in process in January. We will communicate with students in advance so that you can be ready to comply with the state's pre-arrival testing requirements. But one thing I urge you to do is make sure that you are aware of testing capabilities and services available in your area. Are you sick of testing? I know I am. But you know, the simplest way to manage COVID right now is to stay safely on campus for the next 21 days until the end of on-campus study. Please do not go to gatherings where people are not assuring safe distance and are not wearing masks. On Friday night, we hosted the virtual O'Connor Chair Lecture that is endowed by the A. Lindsay and Olive B. O'Connor Foundation, and I thank the foundation for your support. The topic of the lecture was, where do we go from here? A forward-focused look at COVID-19. The speakers were excellent. The speakers included our moderator, Assistant Professor of Nursing and Community Health, Nicole Zhang, Dr. E. Allison Holman, who is a professor of nursing at the Sue and Bill Gross School of Nursing and Department of Psychological Science at the University of California, Irvine. Christopher Holmes, the Director of Emergency Management for the Office of Parks, Recreation, and Historic Preservation. And our own Harvard College graduate, Maria A. McPherson, who is the Acting Director of the 14 County Central New York Regional Office of the New York State Department of Health. These excellent speakers confirm much of what we know about COVID-19, what it is, how it spreads, and how to manage it. But they also addressed how we humans react to extended trauma and the needs that arise when managing a crisis of this significance. Among the important takeaways, you don't have to get COVID to be deeply impacted by it. Those who are on the front lines of decision-making for others, those who are caring for others, and those who are simply caring for themselves all need our extra consideration and compassion right now. Please do something kind for yourself and for someone else today. Take a walk. Pet your dog. Send someone a photo you enjoy. Call someone to let them know that you were thinking of them. It will make a difference. Dreams take a new meaning, shape, and color in COVID world. Today's song, entitled "That's What You Call a Dream," reminds us all that a quiet life, the life we are being asked to live at this time, can also be the perfect life. It's performed by Melissa Vanderschief. Be safe. Wear your mask. Have a great Sunday.